All right, good evening. If you're here, please. All right, good evening. Write down your name. If you're here, please. All right, good evening. Write down your name. All right, good evening. Write down your name. So if you are here and you are part of this mock live mock question and answer session, please write your name. Let me know that you can see the screen clearly and you can hear my voice. Please, if you can hear my voice and you can see the screen, just write your name. Let me know that you can see. So when you write down your name, you say you can see and you can hear me. So that will begin. Write down your name. So that and let me be sure that you can hear me clearly and you can see. Can you see? Am I loud and clear? Let me know if I'm loud and clear. I can see that there are about 7 people on that have joined the live session. Please write down your name and let me know if you can hear me clearly so that we can begin. Sorry for the slight delay. I had some hiccups, but we're here. So if you can hear me clearly, please indicate. And if you can't hear, please indicate also your name and let me know if you can hear me. We'll soon start in 1 minute's time, but I need to know if you can hear me. So type using the comment section that you can hear me. The place that you can see chat. So type in that we can hear you, sir. So if you can hear me, please do that. Type we can hear you, sir. Okay, Stephanie is here. Can you hear me clearly, Stephanie? If you can hear me, please write that you can hear me. Let me. All right, thank you. I should have said he can hear me and he can see the screen very well. So that we can start in earnest. Okay, all right. Okay, so I think we can begin. Okay, Otnell can hear me too. So the reason why I decided to do this, and we'll be doing this on certain days. Your class rep will let you know the days that we're going to be having this discussion. The result of your other group, other batch was very poor, and that's why I decided that the multiple choice question or best of 5 questions, you need to have an idea on the best way to answer it. Okay, so today let me begin by being a bit biased. So we'll start discussing questions in endocrinology. We'll have time to discuss infectious disease, pulmonology, gastroenterology, and other cardiovascular. So that will be dependent on the periods that I have time. So let's begin. So this is a question in endocrine, okay? So I'll read it and I'll give you time to answer it before I give my answer. I think I said similar. This session is very important. There's no way I'll bring exactly the same thing, but it will likely be similar, right? Okay, so a 20-year-old man presenting to the endocrine clinic with a complaint of tingling sensation on the feet. He has family history of diabetes and the BMI was 36.8 meters square. The glycated hemoglobin was 6.3%. What is your diagnosis? So what is the diagnosis here? If you're sure of the diagnosis, you write in the comment and the chat box. Is it diabetes? Is it pre-diabetes? Is it hyperglycemia? Or it is none of the above? So if you know the diagnosis, write it in the comment section. I will give 1 minute for each question maximum. If there are no answers, I'll answer it and explain. Okay, so Stephanie, Ashu, Abdul, Abubakar, Adnel, Yunus, any answer for me? This first question. So we have 1 minute maximum for each question. If you know the answer, write in the comment section. So the questions that we are going to be asking you are basic, simple. And that's why if you don't answer it sincerely speaking, there's no way there's no way you will pass. They are going to be simple things and things that you have been taught in class, right? So any answer, I have few seconds. If you don't answer, I will answer it. After answering it, if you have questions, then you ask. Does anybody have an answer to this number 1 question? We have few seconds, then I will answer. Does anyone have an answer? Okay. Kabiru Yusuf said diabetes mellitus. Okay. Any other person? I'm waiting for another answer. You're welcome, Fatima Abubakar. Okay. Odnell also said diabetes mellitus. Okay. Any other person? Any other answer? Okay, I have not received more answer and my time is up. Okay, so I'll answer it. Okay, so what is clear here is that, okay, someone answered B. Okay, Abubakar, I don't want to say B. So yes, the answer is pre-diabetes. So if you look at it, the patient has risk for diabetes. He has the family history of diabetes. He has obesity, right? But the HbA1c of 6.3 is pre-diabetes. I told you in class that normal HbA1c is less than 5.7, and 5.7 to 6.4 is pre-diabetes, which this figure, this value here falls into pre-diabetes. While if it is 6.5 and above is diabetes. So this is pre-diabetes. Okay, so let's go to the next question. If you have any question, you can drop it in the chat box. So this is number 2, the second question here. Okay, so the patient in question 1, so we are referring to the earlier answered question. So the patient in question 1 was subjected to OGTT, oral glucose tolerance test. The result was as follows. The 0 hour is 6.2. The 2 hours is 11.2. Right? So what is your diagnosis now? So this is a follow-up to that patient. We went ahead to do an OGTT and these were the values. So are you dealing with pre-diabetes? Are you dealing with hyperglycemia? Are you dealing with diabetes now? Or none of the above? Okay. So for number 2, what is the answer? If you know it, we have also 1 minute for you to answer. If you know the answer, please write it in the comment section. What does the patient have? Is it pre-diabetes, hyperglycemia, diabetes, or none of the above? Okay. So Abubakar said C. Mahmoud Musa also said C. Ashuri also said C. Okay. Exactly. C. Mona also said C. Okay. So the answer is C. because the 2 hours postprandial, that's the 2 hours after 75 gram of glucose, is 11.2. And I told you before, okay, same as Bilal, if it is 11.1 and above is diabetes, so the patient has diabetes. Good. So I like the way you people are following it up. So nobody should come and fail any of my questions. Okay, so number 3. A 35-year-old woman presented to the endocrine clinic with the complaint of polyuria, excessive passage of urine, both in frequency and volume. That's polyuria. Please let me not ask you what is polyuria in exam. You say you don't know. Polydipsia and body weakness. Okay. Fasting blood glucose was 14 millimoles. The BMI was 17 kilogram per meter square. The serum C-peptide, as I told you in class, is a test that assesses insulin production. I said in class that C-peptide is co-secreted with insulin. So the C-peptide was 0.2, normal is 0.7 to 1.7. What is your diagnosis? Okay, is it type 2 diabetes, type 1 diabetes, just diabetes mellitus, or hyperglycemia? Okay, Abubakar said B. Does anybody have contrary answer to this? He said it's type 1 diabetes. Abubakar, can you tell us why, type in the chat box why you think is type 1 diabetes? Okay, Salim Kabir said it's type 2. So I need answer, as I usually tell you people. My middle name is Y, so type the Y, not just the answer. So most people here said it's B. Why is it type 1 and not type 2? Okay, so can you give me answers? Abubakar, Adamu, Umar, we answered first. Okay, so why do you think it's type 1? And for those who say it's type 2, why do you think it's type 2? Okay, someone said C-peptide, the typing is not complete. Okay, Mahmoud Musa said the decrease in C-peptide and weight loss. Okay, yeah, the patient has. So people that have type 1, they're usually slim build. So this patient has a BMI of 17 gram per meter square, which is underweight, right? Very good. And also the C-peptide is low, which is not very good. Abubakar, C-peptide is low, which indicates that this is very low. If it was just slightly low a hand, but this is quite very low. So any C-peptide that is less than 0.6 is likely type 1. So this patient actually have type 1, okay? Because first is slim build and has very low C-peptide, okay? So as I said, you can ask. So you remember I talked to you about gestational diabetes, the values that define gestational diabetes, okay? We didn't go into details concerning gestational diabetes because that's not necessary, right? It's not for your level. So, but this one, I just said it by the way, but if somebody has the answer, you can answer it, okay? So which of the following values defines gestational diabetes? To just give you a recap, gestational diabetes is any glucose abnormality first detected in pregnancy, and the American Diabetes Association gives us the ranges at the blood glucose at 0 hour, at 1 hour, and at 2 hours. Okay, so which of the following do you think defines gestational diabetes? Number 4. If anybody has answer, should answer. If not, I'll answer it and explain. So number 4, do we have an answer? Do you have Ashuru, Abubakar, Adnel, Mona? Let's answer this 4. We have 1 minute. If there are no answers, I'll answer it myself. It is important that everybody attend the live session. It's always better to learn live rather than to watch the video later. Though the video will be on my channel, even if I'll make sure it is part of the save videos under live session for people to watch again. But it's also always better to attend the lectures live, isn't it? Okay, so let me answer this. So according to the American Diabetes Association, pay attention, the 0 hour, the fasting blood sugar should be 5.1 and above. The 1 hour should be 10 millimoles and above, and the 2 hours should be 8.5 millimoles and above. So from these values, you can see is B, which is 10.2, that defines gestation. Let me repeat again. Fasting should be 5.1 and above. 1 hour should be 10, and 2 hours should be 8.5. So B is the answer here. Okay. This question, when we do other lectures, we'll answer them. Okay, but this one is a very good question, right? For those who have not done endocrine posting, I have to give you a hint so that we can answer this. So for you to know the endocrine causes of diabetes, you only need to know the hormones that oppose insulin. You know, they taught you in physiology certain hormones that are counter-regulatory hormones that oppose the action of insulin. When in excess, they can cause diabetes. Okay? So the question here is, the following are endocrine causes of diabetes except thyroid toxicosis, that's excessive thyroid hormones; acromegaly, that's excessive growth hormone; Cushing syndrome, excessive cortisol; then Addison disease. So which one doesn't cause diabetes? That's the question, because there is except. Which of them doesn't cause diabetes? Any answer? Exactly, Mahmoud Musa, that's exactly. So Addison is deficiency of cortisol. So deficiency of cortisol will rather cause hypoglycemia. So D is the answer, right? Because I told you hormones that oppose the action of insulin, and these hormones include the growth hormone, which is if it's excess will cause acromegaly; the thyroid hormone, which in excess causes thyroid toxicosis; the cortisol, when in excess, causes Cushing syndrome, right? But this Addison, which is low amount of cortisol, will cause hypoglycemia, is a low sugar. So this Addison is the answer, because it will cause hypoglycemia rather. So this one is just asking you a physiological question, and I expect you to know, because you're just coming out of, you're just finishing your degree in preclinical. So I have much expectations when it comes to physiology. Okay, so another interesting one here. All right, so it said a 44-year-old man presented to the endocrine clinic with unexplained weight loss. So he's losing weight, right? He was found to have type 2 diabetes. He has family history of diabetes. He hardly exercises, takes a lot of refined sugars daily, like most medical students. BMI was 25.2 kilogram per meter square. Has BP of 130/90. What in this patient is not a risk for diabetes? So this is talking about the risk for This is talking about the risks. This is talking about the risks for diabetes. So which of these following factors is not a risk for diabetes? That's the question. Can you still hear me? If you can still hear me, please write that loud and clear so that I'll be sure that you're following. Abubakar Umar, Mahmoud Odnell, Patience, Ashuru. If you can still hear me, please write loud and clear. Before I continue. Okay. Some people are not getting me. It says some completely off. Okay. How about other people? Can you hear me, or we are having challenge? Okay. If you can hear me, let me know. Write loud and clear. I want to know. It depends on your network. Your network has to be good. It's like some of you don't have, anytime you're going to have anything that is live or online, you have to ensure that your network is good. Some of you are having challenges. Okay. Hello? Hello? Hello?
Good evening, sir.
Yeah.
Sir, it's like we cannot comment. The button is showing is like it's not pressing.
But some people are commenting.
Okay, just now?
Yes.
I have tried it, I couldn't.
I think it's your network. It's your network.
Thank you, sir. Yes, sir.
So as I said, you have to ensure that your network is very good anytime you have online meeting, okay? At least Mahmoud Musa's network is very good. So you have to ensure that your network is very good for you to do any kind of online meeting. It's very, very difficult. So from this, let me just answer this. So for next meeting, please ensure you are in a place where your network is good. Okay, so the answer is 44 years old. Based on the risks of diabetes, one, the patient should be 45 years and above. Family history of diabetes is a risk for diabetes. BMI of 25.2, that's overweight. I tell you the truth, as a medical student, 400 level medical student, you must know BMI classification. You cannot write any exam without knowing BMI classification, please. So this is overweight. BP of 130/90 is hypertension, because that 90 is diastolic hypertension. So an hypertension is a risk for diabetes. Sedentary lifestyle is a risk for diabetes. So the answer here is that 44 years, because it's 45 years that is a risk of diabetes. But I told you, because of the change in lifestyle, this doesn't hold water. But this postgraduate discussion anyway. But for you, the one you see in your the one you see is 45 years. So, as I said, if your network is not very strong, it will be going off actually. Apologies. So, you guys are new to all this online stuff, right? So, if you're going live and your network is not very strong, it will be going off. But for those who have strong network, they can still get me. So, the answer is A here. Let's go. We'll try and finish on time today, because this is the first time. So the next one is complications of diabetes. We did not discuss this, so I'm going to skip this. We did not discuss this in class. and we did not discuss hyperglycemic emergency also, so I'm going to skip it. I will ensure that I will not bring anything that you people have not been taught. We'll only deal with things that you have been taught. Okay? So, but but it may not be in your lectures, so I will just give you an idea in case, because so when I submit questions, the examiner can decide to bring any kind of question. So it's good that I tell you some of these things so that if the examiner decides to bring it, you will not have problem. So which of the following is non-vascular complications of diabetes? So diabetes has vascular complications and non-vascular. It's the vascular complications that you know it is divided into microvascular complications and macro. The microvascular complications include the neuropathy that's affecting the nerve, nephropathy affecting the kidney, and retinopathy affecting the eye. While the macro, that's big blood vessel, is the one that leads to stroke, heart attack, and peripheral vascular disease. So when we say non-vascular complications, they are the ones that involves the skin, right? So the answer is skin diseases in diabetes. They are non-vascular, or skeletal abnormalities. So this one, the answer is B. But we are going to have additional lectures, I think. So during that time, we can discuss other things. Okay. So we'll be trying to beat time. So for thyroid, I told you in thyroid problem can be from the gland itself, or can be from the pituitary, or can be from any other source. So when they say hyperthyroidism, there's difference between hyperthyroidism and thyrotoxicosis. Thyrotoxicosis is the umbrella term for any kind of high thyroid hormones that leads to symptoms. But if they say hyperthyroidism, that means the problem is from the... So this question said, the following are causes of hyperthyroidism except... Okay, so Graves' disease is from the gland, right? It's an autoimmune problem involving the gland, right? Levothyroxine toxicity is not from the gland. Toxic adenoma is from the gland. Toxic multinodular goiter is from the gland. And you can see that some people have already answered it, right? Abubakar and they have answered it. So the answer is levothyroxine toxicity, because it's not from the gland. You are taking levothyroxine and it's causing problem. So that one is not from the gland, and that is the answer. Very good. So some of you already know it. I also talk to you people about what is it called? About calcium. Okay, so let me see if anyone will be able to answer this question. Okay, so this one, they said 30-year-old woman presenting the endocrine clinic with a complaint of spasm of hands and feet. That's a capopedal spasm that people with hypocalcemia will have. They said that the calcium is 1.5, which is very low. Phosphate is high. Parathyroid is elevated. Vitamin D is low. Magnesium is normal. What is the diagnosis? We know we answered this. So what happens in calcium metabolism? When you see that the parathyroid is high and the vitamin D is low, what do you think is your answer? Let me give you between these two options. Is it severe hypocalcemia secondary to vitamin D deficiency, or mild hypocalcemia secondary to secondary hyperthyroidism? Or is it primary hyperparathyroidism or vitamin D deficiency? So what do you think is the answer? This one is a bit complex. Let me just answer it for you. Okay, but someone has already answered it. That's very good. Mahmoud Musa has already answered it, which is good. So the 1.5 is very low, right? The 1.5 is very low. So that's severe hypocalcemia. But what is the cause? Since vitamin D is low and the parathyroid hormone is compensating by being high, right? That means the issue is what? Vitamin D deficiency, right? If it was hypoparathyroidism, the parathyroid would have been low, right? So the answer here is C. Very good, very good. There is high indication that you people are going to make me proud. All right. Okay, so does anybody have question? Today is the first day. I want to be as light as possible. If you have any question, I tell you the truth, right? My questions will come out from this kind of thing, but it will not be exactly, but it will be from this one. So it will definitely be from this, but of course our partnerability change the stem, change everything, but the idea will still be the same. So if you have question, you better ask, because this will be the end of endocrine. Right? I'll be taking it system or topics by topic based on the topics that you have been taught. But today, and I prefer introducing using endocrine, at least my own topic, so that I explain it clearly. Please, if you have question, type it and I will answer. You have, let's use the next 5 to 10 minutes to answer any question. I will not be happy if any of you fail any of my questions during your end of posting. So please, if you have a question, Jamilu, do you have a question? Adamu, Abubakar Adamu, Otnel, who again? Mahmoud Musa. Any question? Mona. If you have any question, please ask. Because in the day of exam, as I said, I will change it. If you cram what is here, you are likely, there is high chance that you are going to fail. So if you have any question, please ask. If not, just write "thank you, sir," so that we can finish the live session. If you don't have any question, just write "thank you, sir." Then we'll discuss with your class rep what the next online discussion will be. Okay. Any question? Okay, so obviously no questions. So we'll end it today. We'll see how we'll do other. The next one will likely be cardiovascular system. So we'll see how we'll cover it. Okay, so since there are no questions, I'll choose a date and time and I'll communicate it to your class rep. The next one will be the cardiovascular system. We'll see what we'll cover based on the topics that you have been taught. All right, so have a good night. Bye bye.